Frank, you are a bladder cancer survivor. Congratulations.
Thank you.
Talk to us about your diagnosis. When did you know something wasn't right?
It was actually 5 years ago in 2018. I had a tinge of redness in my urine. And I knew at that point something was wrong because obviously your urine should not have any type of color of red to it. So it indicated that there was some bleeding in my urine. And that prompted me to head off and talk to my primary care physician. At that point, after they ran some tests, they found a tumor. And at that point, I was whisked off to Dr. Matt Kaag at Penn State Health.
So what was going through your mind when they said, there's a tumor?
I was titled a bull in a china shop. Thought it was the end of my life. I thought it was over. As soon as you see something wrong, you automatically want to deny it. You don't want to reach out and get help because you're afraid of what you're going to be told, and that's the worst thing you can do. You need to jump when your body's telling you something's wrong. You know your body. Everybody knows their body. When you realize there's something wrong, make that phone call and get help. And there's always something in the mix that will follow through and you can get better. And I was one of the lucky ones.
You met Dr. Kaag.
I met Matt Kaag.
And tell us, as far as what was the treatment plan, what did you decide to do?
So Frank arrived to our clinic at a somewhat more advanced stage than what your dad did. He had already been started on some chemotherapy, which was an appropriate choice, but he wasn't tolerating it very well. And he was not a happy camper. I think that's a safe thing to say.
That's a good way.
So I counseled him in favor of having his bladder removed. We talked about different ways to reconstruct the bladder or reconstruct the urinary tract so we could get the urine out of the body the way it's supposed to. And what we settled on was an operation called a neobladder. He was very quality of life focused and really didn't want any sort of external bag. And so we were able to rebuild his bladder with the length of his intestine and basically give him a reservoir that holds urine and allows him to pee normally.
Oh, that's wonderful.
That's crazy.
Frank, why don't you tell me as far as your lifestyle changes?
Well,
we were talking earlier and you said you made some changes right away.
As soon as I heard the word cancer, I was a cigarette smoker. I was also a volunteer firefighter as well, taking in carcinogens and that sort of thing. But obviously, cigarette smoking is just bad. I didn't want to give my body a chance to pick up cancer anywhere else. So actually, February 9th of 2018 was my last cigarette. And I've not touched them, nor do I can tolerate cigarette smoke at all, period. Along with that, I really focused on biking. I haven't been out in the trails like I should be this year yet, but I'm getting the
weather's better.
I'm getting the track bikes are getting ready to get moving, and I do a lot of biking and walking as much as possible. I watch my weight. I'm 50 pounds less than what I was back in 18, and just try to have a very healthy lifestyle. I have a different viewpoint now, and you know, and I run ambulance back in the day as well. So you know, you talk to patients, they think it's the end of the earth, and they just need to take care of themselves.
Right.
And that's key after a major surgery. Dr. Kaag operated on me July 16th of 2018. By December 19th of 2018, I was back back on a paramedic unit part-time.
Yeah,
Never
sound like
thought,
my dad.
Yeah.
Get back
crazy.
out there and do what you love. Dr. Kaag, how important is it to change your lifestyle and keep moving forward?
It's incredibly important. My all-star patients are the ones that engage in their own recovery. And so I know that I can get somebody like Frank back to normal, healthy, happy lifestyles quickly because he was really motivated to get there. And it makes it a really good cooperative effort between the doctor and the patient when everybody's working for the same goal.
Frank, what is your message to our viewers watching tonight?
The biggest message to the viewers would be, when something is wrong, you know something is wrong, whether it's even your urine is different color, you're just not feeling right, you're having pain, you think it's just a normal headache or whatever, make a phone call and get checked. It could save your life. If you just don't want to let things drag on. It's the same thing as I heard earlier, if your car is running wrong or something, go get checked. Don't mess around.
And Dr. Kaag, do you want to echo in on that?
There's not much to add to that. I think that's absolutely correct.
Yeah, so if you know something's not going right, go get it checked out, especially when it comes to your bladder, because if you're treated early, it's a much better outcome.
Yes, I agree.
Right.
Okay, but you're doing wonderful.
Yes, I'm
And-
very, very happy. I have a great quality of life, and I also serve on the bladder cancer support group for Hershey Urology, so it's the least I could do.
Okay, great. Thank you both for being here.
Thank you.
Thank
Thank
you for
you.
sharing your story.